Hello and welcome to Module 3 of the Lactation Workshop, which is on breastfeeding or just feeding, history taking, and antenatal preparation. I am Dr. Madhu Shweta Sharma, currently an assistant professor in OBG department in St. John's. We start with the introduction. Why is antenatal counseling so important? There has been seen a very positive effect of antenatal counseling on the mother's decision to breastfeed their babies and on breastfeeding. Only 44% of infants aged 6 months worldwide were exclusively breastfed from 2015 to 2020. 8,20,000 children's lives could have been saved every year among children under 5 if all children 0 to 23 months were optimally breastfed. Among all the interventions for continuation of breastfeeding, today we will learn about breastfeeding counseling. WHO recommends at least 6 breastfeeding counseling sessions, one of which is in the antenatal period. The others are immediately after birth, neonatal period, early infancy, at 6 months when complementary feeds is started, and late infancy and early childhood. Why mothers in England don't breastfeed? Only 36% of babies in England were receiving some breast milk at 6 months compared to 71% of Norwegian babies. 8 out of 10 women stopped breastfeeding before they wanted to and could have continued with more support. On being asked why, they felt that they were unsupported and they found breastfeeding very difficult, not acceptable in public, and difficult to combine with work and lifestyle. In this session, we try to find out what difficulties the women are having with breastfeeding and to offer them solutions. The learning objectives of today's sessions are how to elicit history of a woman's previous experiences of breastfeeding and any concerns related to this, how to be able to troubleshoot any problems related to breastfeeding antenatally and to advise when to seek professional care, and to provide information regarding availability of breastfeeding support locally. We start with the introduction. In a session of breastfeeding counseling, we have to include the mother, the partner, and the immediate caregivers who are ultimately involved in taking care of the baby. What are the components of counseling? They are history taking, breast examination, and the benefits of breastfeeding. We start with the introduction. The aim of history taking is to identify at risk mothers. Clinically, they may be those mothers who will give birth to premature babies, diabetic mothers, those having multiple births, cleft lip and palate of the baby, and people living with HIV. The other high risk factors may be primipares, women who did not breastfeed their previous children, women who were unable to exclusively breastfeed their babies for 6 months, and those women who are reluctant to breastfeed. History taking. While taking history, we have to be very aware of the social barriers and other issues, and we have to address the conflicting feelings that are involved in the decision to breastfeed. The conflicting feelings may be any previous bad experience in relation to breastfeeding, any history of sexual abuse, in which case we have to get the help of a psychiatrist or a psychiatric social worker. In this chart, we see the barriers and facilitators of exclusive breastfeeding for up to 3 months. See the barriers from institutional level and above, which are lack of knowledge of breastfeeding friendly laws, formula feeding as a cultural norm, the sexualization of breastfeeding, institutional bias and racism, unhelpful lactational support, and lack of lactational supplies. The facilitators which can be access to breastfeeding friendly workplaces, access to maternal leave policies, breastfeeding feeding being a generational tradition, cultural or familial norm, breastfeeding being a religious norm, virtual lactational support, doulas, CLC, peer counselors, support groups, and having the correct lactational support. The measures that improve breastfeeding rates are implementation of code of marketing of breast milk substitutes, interventions like the baby friendly hospital initiatives, counseling provided to mothers and families, increase in the maternity paid leave, money for breastfeeding research and education, workplace protection with appropriate rooms to express their milk or daycare centers close to the workplace where women can breastfeed their children. On the interpersonal and the individual levels, the barriers are discouragement from partners, friends, and social networks. On the individual level, breastfeeding is time consuming, difficulties with pumping, the need to change their diet, pain, engorgement, and cracked nipples. The facilitators of which are support from partners, parents, friends, and social networks, the increasing the determination and intention of women, prior knowledge of the benefits, telling her that breastfeeding is cheaper, and teaching the woman how to achieve a good latch. An example of how your breastfeeding counseling session can go is if she's a primary gravida, you ask her, how do you plan to breastfeed the baby? Then you explain the benefits of breast milk and exclusive breastfeeding. In case she's a multi-gravida, you have to ask her, how did you feed your previous baby? If she had done exclusive breastfeeding for the previous baby, then you just need to reinforce. If she had partially breastfed or never fed her previous baby, you have to inquire why. Was it because of illness, low milk, or unemployment? And we have to give her appropriate advice, reassurance, and explain the benefits. The questions that can be asked during a session are: what would be your choice of infant feeding for your children and why? How did you feed your previous baby for the first 6 months? Did you give your baby any other food or fluids? If yes, then why? We start with the introduction. Now we go to breast examination. Why should we examine the breast? It helps reassure the woman about her ability to successfully breastfeed the baby. It identifies mothers with nipples that might require assistance with feeding. The do's of examination are: examine breast only if a problem arises, ask her what she has noticed about her breast, explain what you want to do, and be gentle. In the don'ts are: don't examine routinely, don't touch without permission, don't examine without privacy, and don't sound critical about her breasts. We start with the introduction. The benefits of breastfeeding for the baby. All the nutrients curtail to the specific needs of the baby. It has high quality nutrients and helps protect against infection for up to 2 years. Protects babies from infections and illnesses. Babies find breast milk easy to digest and it does not cause constipation. It has been seen that breastfed babies have higher IQs. For the mother, it helps in natural and safe birth spacing, helps the uterus to contract, lowers the rate of breast and ovarian cancer in the mother, aids in weight loss, and increases the bonding between the mother and the baby. And it is easier to carry out. This chart shows adverse health outcomes which are increased without breastfeeding. In infant, the short-term adverse outcomes are infections, sudden infant death syndrome. The infections include necrotizing enterocolitis, sepsis, pneumonia, otitis media, UTI, and in the long term, we see that there is increased risk of obesity, asthma, diabetes, leukemia, and a lower IQ. Because the woman may not have breastfed, she would have a shorter birth interval, which will increase the risk of the second sibling having small for gestational age, low birth weight, and perinatal death. The adverse effects for the women of not breastfeeding are not getting the protective benefits of breastfeeding for the prevention and the decrease in the risk of breast cancer, uterine cancers, and ovarian cancers. Metabolic syndromes like hypertension, obesity, and diabetes are increased. There is increased risk of obstetric complications like unintended pregnancies. For example, a shorter interval with a prior cesarean section can lead to increased risk of uterine rupture, placental abruption, and placenta previa. We start with the introduction. Antenatal counseling for people living with HIV. The WHO says that the governing bodies in the countries can decide whether to promote and support breastfeeding or promote and support replacement feeding among HIV infected mothers. The information regarding the pros and cons are to be provided to the mother as soon as possible so that she has sufficient time for reflection. This is also called informed choice. The health risk for reproductive cancer, diabetes, and obesity is already more for a person living with HIV. And when we tell them not to breastfeed, it takes away from them all the benefits that can be obtained from breastfeeding, like immunological support for the baby, nutritional gains, and bonding between the mother and the baby. We start with the introduction. Some of the problems that can be encountered in the antenatal period are leaking from breast. Please advise her to go see her doctor. Once the doctor has given a go ahead, you can tell her about colostrum harvesting. Please remember to advise her not to collect her colostrum if the mother has a cervical stitch, has a history of preterm labor, has had contractions, vaginal bleeding, and or premature rupture of membrane during this pregnancy. The other problems can be large or small for gestational age babies, twins or triplets, the baby has a cleft palate or a lip, and the mother is having absent nipples. One of the common questions are what to do if I am pregnant and breastfeeding. So, pregnancy and breastfeeding together are usually safe and is also known as tandem breastfeeding. But the mother can wean the child if she wants to. And again, you have to advise once to go see her healthcare provider. Few points to keep in mind during antenatal counseling are give well documented facts in an objective manner, cite references for facts, and refrain from giving personal opinions. We have to encourage her to seek her caregiver's advice and to share her concerns openly, to remind her caregiver that she is breastfeeding, and to discuss drug substitutes in a neutral manner, citing reliable sources. The don'ts of antenatal counseling are do not interpret in drug information unless you have prescriptive privileges. Do not advise about a drug safety and read straight from literature. Do not indicate that you disagree with advice from her caregiver or other medical sources unless you are medically qualified. Do not suggest that she refuse a drug when it is needed. And do not encourage her to act against her caregiver's advice. We start with the introduction. Breastfeeding health. You can refer the mother to online resources like the La Leche League online support. You can also form WhatsApp or Telegram groups or a Facebook page where women can freely discuss their problems and struggles. It is a very good way to let the women know that they are not alone in this journey. The measures that are initiated in India to help breastfeeding are the Anganwadi Services Scheme, which provides counseling for pregnant and lactating mothers on infant and young child feeding practices. The Pradhan Mantri Matru Vandana Yojana maternity benefit scheme with cash incentive of 5,000, which aims at partially compensating for their wage loss. The Poshan Abhiyan addresses the malnutrition related issues in mothers and children. The Maternal Absolute Affection, which is a program by the Ministry of Women and Child Development which promotes breastfeeding and infant and young child feeding practices. The home-based care for young children, the HBYC, which is an extension of home-based newborn care. The Village Health and Sanitation Nutrition Days, which helps in spreading awareness, and the revised Mother and Child Protection. To summarize our lecture, we had started with introduction, then we proceeded to whom to include in a session of counseling, history taking, what are the barriers and facilitators, breast examination, benefits of breastfeeding, antenatal counseling for people living with HIV, problems in antenatal period, and breastfeeding health. Thank you for your patient listening.